May I introduce you to Dr. Rodberg and thank him for his distinguished presence here this evening. My friend Caterina is the national president of Women's Hotel Owners in Italy. She is telling her colleagues that she has been under my professional care and that my message is extremely important as a new approach to health. Good evening. I would like to thank my patients Osvaldo and Lucia for inviting me to Torino to work on 20 of their friends, and Caterina and Giuseppe for their hospitality in the penthouse of their beautiful hotel and for organizing and filming this event. Project Genesis is beyond your wildest imagination. Rigorously scientific, mathematically precise, powerful, fast, clean, economical, honest, ethical, and simple. This evening, I will explain and demonstrate its basic principles and practices so that you can understand why I disagree with 98% of today's healthcare system. Let's follow simple, immediately verifiable applications of common sense in the opposite direction to that which you consider normal, and show you an approach to health that is far superior to anything you have ever seen. Let me give you a little of my background. From birth, I had many health problems for 25 years. Seeing doctors and taking medicine and getting a college degree in biology didn't get me any better. Since I was taught the relationship between cause and effect during my doctorate in chiropractic and my specialization in applied kinesiology, I have been living without my old problems for more than 30 years. I only visit the optician and the dentist when I need them. More than 30 years have passed without any other kinds of medicine, herbs, pills, exams, or therapy. I would like to teach you how to do the same. We will start with my patient and friend, Fran Carla. She, her husband Mario, and I have been working together for 2 months. We will do our demonstration together to save time, and then she will share with you her experience. We will do our first lesson today exactly as I always do in my office. I call it the field trip. The field trip allows me to demonstrate and allows you to feel, understand, and immediately verify the 5 free methods that we will use to get you better. They are weights, wrapped ice, chiropractic, oriental lymphatic drainage, and my personal teaching methods. Please imagine that you are Fran Carla and that this is our first meeting. I will give you an approach that is the same for everyone. The patient's age, sex, kind of job, diagnosis, past surgeries, and accidents are rarely important in this phase of our demonstration. Come here, please. The first thing we do is to invite the patient and their friends and relatives to examine my abdomen. She will check to see how much space there is under my diaphragm for me to breathe, digest, and eliminate. Fran Carla, please push gradually and gently and be aware of how deep you can go. The 2 questions you need to ask yourself are, 1, is the doctor's abdominal space normal? And the answer is yes, it's anatomical and physiological. And 2, ask yourselves, Do I have the same space in my abdomen? And the answer is, no, you don't. The first time friend Carla examined my abdomen, she was very surprised, weren't you? Your abdomen was hard, swollen, and painful, while mine was free. Now, we will explain the breathing. Our lungs live inside the rib cage. To give them air, we will demonstrate the two main methods for increasing space. 1, lifting the ribs that make up the walls, called thoracic breathing. And 2, lowering the floor, called diaphragmatic breathing. To breathe above, we have to lift the weight of our bones, muscles, and breasts. This can be quite an effort. It is automatic to use this kind of breathing when we are excited, angry, surprised, in pain, in a hurry, and involved in intense physical activity, but not for 24 hours a day. In simpler and more restful activities, our body automatically lowers the diaphragm. If the space is not compromised by an intestinal block, we have an automatically anatomical and physiological breathing system which facilitates breathing, digesting, eliminating, filtering, resting, healing, assimilating, really everything that we call our resting metabolic processes. These are the two ways in which our body is built to breathe. Now, let us finish the patient's examination of my abdomen by testing the strength of the muscles. Friend Carla, if you want, you can push harder. There is a big difference between intentionally tensed abdominal muscles and an intestinal blockage. May I ask you, have you ever experienced a medical approach that started like this? A doctor who presents himself as an example of good health? Demonstrating is often much clearer than speaking. Friend Carla, it's your turn. Please lie down and bend your knees. Instead of invading her abdomen, as unfortunately doctors too often do, I gently take her hand and we look into each other's eyes. With her hand, I push slowly and gently in her abdomen until it starts to feel uncomfortable. Then I stop. Today, she will not be disturbed. Now she is aware that her intestinal problems were the cause of all of her other suffering during her whole life. Now she knows how to protect, recuperate, and manage her own health. This is very important.